name's Corwin Pattis. I'm a physical therapist at Pacific Neuroscience Institute. I specialize in neurodegenerative diseases, fall prevention, and cognitive impairment. This video is going to cover people that are high risk for falls and some fall prevention techniques that we can use at home to reduce that risk moving forward. All right, so we're going to start by demonstrating putting a gait belt on our loved one. Gait belts are used to allow a caregiver to provide some extra assistance when needing to stand up or perform transfers and even during gait. So step one is properly putting on the gait belt. With our loved one seated, we want to ask them to lean forward in the chair, and we'll make sure that the tag of the gait belt is inward. We'll wrap around the waist like so. We'll thread the gait belt through the teeth. We want to make sure we cinch it relatively snug because it can loosen as we stand up. Sometimes we may need to refasten it as they stand up, but this way, as it's snug, we have a good grip. After it's all the way pulled through, you can loop it under and then tie it so it stays somewhat out of the way. Now what I'm going to ask you to do is we're going to stand up. Okay, I know you're having some trouble getting up, but I'd like to make it a little bit more smooth. So, on the count of 3, I'm going to grab behind the gait belt so I have a nice grip underneath like this. I'm going to provide some assistance to help you stand up all the way. You tell me, you count down for me.
1, 2, 3.
Good. Making sure you're standing next to the loved one and you have a firm grip in case they lose their balance. You're able to pull them close to you for security or help them guide back into the chair if they feel dizzy or lose their balance. Okay? If your loved one has a little bit more challenge getting up and over to a seat, we can use stronger mechanics where we're using more of our legs to get them over to a chair, for example. So we're going to move to the chair here. What I'm going to do is help you up. We're not going to actually stand up all the way, but we're going to come up as high as you feel comfortable, and we're going to pivot over into the chair. So I'm going to bring the chair over as if this may be a wheelchair that we're locking and moving over. Are you ready?
Ready.
Okay, so from this position, we want to make sure we straddle our loved one's legs so we have security here. And we're going to have 2 hands on the gait belt. We're going to get in a squatted position. And this is the most important thing because now we're using our legs and our backs protected. Most important thing when we're transferring is making sure that our bodies stay safe so we can keep doing it. What I'm going to have you do is we're going to rock together and we're going to get your bottom up off the chair and then we're going to pivot over to this table. Okay, are you ready? 1, 2, 3. Good. So notice how I could always keep my back straight, move with my loved one, and everything stayed inside the legs. Okay? All right, now what we'll do is we'll assess the correct fit for our 4-wheeled walker. And after we assess the correct fit, Hayato, what we'll do is we'll practice some correct mechanics of where we should stand when we're using it. Okay? So what we'll do is stand up. I'll grab this gait belt. After you're standing, I'd like you to hold on with both hands for a second.
Okay.
All right, you count down for me.
All right. 1, 2, 3.
Perfect. Hayato, can you sit back down?
1, 2, 3.
Perfect. So this time, instead of standing up with 2 hands on the walker, let's put 1 hand on the walker for stability and let's push with 1 hand on the armrest. That'll give you some leverage to stand up.
So 1 here and 1 here.
Correct.
Okay.
You ready?
Yep.
Go ahead.
1, 2, 3.
Perfect. So now that you're standing, I'd like for you to hold on with your right hand. And I'm going to keep holding onto the gait belt for some stability. We're going to measure the height of the walker handles. We want to make sure that the walker handles measure to about wristwatch length when their arm is dangling down at their sides. So keep 1 hand on the walker always for some safety. And right now this looks like it needs to go down a couple notches. So I'm going to adjust that for him right now. But before we do that, Hayato, I'm going to have you sit back down.
All right.
For safety purposes.
Right. 1, 2, 3.
There we go. So we can come around on this side here, and every walker's a little different. But this one you need to loosen. And then there's an adjustable knob here. We're gonna push in. I'm gonna go down 2 clicks. That seems like that would be about right. I'm gonna tighten over here, and I'm gonna walk around and do the same thing on the other side. Loosen, go down 1, 2, and we'll tighten it back up. Okay, Hayato. Now what we'll do, same thing, stand up and we'll remeasure.
1, 2, 3.
Perfect. Right hand's gonna stay on the walker. Left hand will dangle down, and that handle looks like it matches his wristwatch perfectly. So go ahead, grab both hands, and you'll notice that his elbows are about 20 degrees. That's what we're shooting for. He's inside the walker, so he has a good tall posture and has some quality leverage to off-weight his weight if he needs to use the walker appropriately. Okay? So this walker's a little tricky. You have to squeeze the handles to let it roll. So we're gonna squeeze the handles, and what I'd like for you to focus on is as you're walking through the walker and going down the hallway, you wanna keep your body upright and your body close to the walker.
Got it.
That's the most important thing to maintain this nice 20-degree angle. All right, and walking with our hand underneath the gait belt, but not firm. We wanna allow our patient or our loved one to be standing nice and tall freely, staying close to their body the whole time. Pivoting with them. Again, staying adjacent, chest is facing them. In case they lose their balance, we can quickly pull them and pull our body closer and pause. Now what we're gonna be demonstrating is pursed lip breathing. This is a technique that we can do if we get dizzy upon standing. That's called orthostatic hypotension, and our medications can have this impact as well. Sometimes our blood pressure will drop if we stand up too fast. So what we'll do is implement pursed lip breathing after we stand up while holding on to the walker. So, are you ready to stand?
Yes.
Okay, when you are, I'm gonna grab behind the gait belt. 3, 2, 1. Are you feeling dizzy?
A little bit dizzy.
Okay, I want you to breathe through your nose and out through your mouth, slowly, trying to slow the heart rate. A cue you can give is smell the roses and blow out the candles. Are you feeling better?
Feeling better.
Okay, good. We can start walking. So now what we'll be demonstrating is setting up for a safe environment for our loved ones to be ambulating around the home to ensure that we reduce the risk of falls and or hazards that could cause tripping. So right now, as you see, this is a very busy, cluttered environment, and we're gonna try to navigate our way through that right now. All right, so we're heading to the chair. All right. There. There we go. Okay. All right, okay. Go ahead and have a seat.
Okay. 1, 2, 3.
Perfect. Okay. Okay, so clearly that was a very unsafe situation, especially if our loved one is a high fall risk. I had to let go of the gait belt to clear the environment to get to the chair. There was times where I was holding onto a water bottle. That can make it more challenging if the loved one does lose their balance and I don't have a free hand to grab onto anything that I would need to help prevent the fall. Simultaneously, my attention was off of my loved one, and therefore, again, if they lost their balance, I may have not been able to respond as quickly as possible because I was trying to get a pillow out of the way or move the shoes. Now we're gonna walk through a safe environment with a room tidy and clean, clear of obstacles, directed towards areas where we would commonly traffic in our home. For this example, a chair in the corner possibly to read or relax. All right, we're gonna head right over to the chair. Reach back with one hand. Perfect. Excellent. So in that situation, I was able to keep all of my focus guarding my loved one and I was able to maintain quality mechanics that we went over previously. There was no distractions between myself or my loved one to navigate all the obstacles and additional components in the room. We're off to the side, nice and tidy. So we're going to do another demonstration walking through a clean environment to the chair in the corner. Just demonstrating the use of the gait belt without a walker, because many people still are not using a walker but are a high fall risk. And we want to reinforce that gait belts are appropriate even if we're not using a walker. The grip is the same. Our body mechanics are all the same. I'm going to pivot. Perfect. So all mechanics, just as demonstrated with the walker, are the same when using a gait belt for a loved one that is not using an assistive device. We want to keep our body close. We want to keep our hand in that nice tucked position while not moving them or pushing them one way or the other, but we have a position where we can grab them and pull them to ourselves in case they lose their balance. Another important component to make sure that we're attentive to is if our loved one has baggy clothing, wearing blankets, anything that could possibly trip them up. Even if they are cold, if we're moving from point A to point B, we want to make sure that we take off any extra clothing that might be impeding or causing a fall risk, or putting on appropriate clothing that might be more snug and warm for them. So we'll demonstrate getting up and walking across the room right now. All right, are you ready? Yep. We're going to move across the room. Go ahead and stand up. Oh, actually, you know what? Before we move, can we take this blanket off?
Sure.
I don't want you tripping over it as we walk to the
Okay.
other room. Okay? All right, are you ready?
Mm-hmm.
Here we go. Lighting is an extremely important thing to consider at home when we have loved ones that are high fall risk. Making sure that the entire environment is visible is going to be essential to allow them to navigate any obstacles, steps, or transitions in surfaces. Important to consider is when lighting may be low. Often we're getting up to use the restroom in the middle of the night, and we want to make sure that we have night lights set in place in these middle of the night trafficked areas. And if there are darker places overall in the home, regardless of the time of day, it might be important to consider other lamps as well to increase the lighting, because our visual system is essential to helping prevent falls by detecting what we have in front of us in our environment. Another important thing to consider when we're talking about light in our environment are potential tripping hazards like thresholds or maybe a change in the surface that is hard to detect with quality light. We can put colored vibrant tape on those areas to further allow our loved ones to identify these tripping hazards. Another component that can contribute to fall risk is incontinence. And sometimes we are in situations where we are either have urge incontinence, but all of a sudden we feel like we need to use the restroom and we're unable to hold it. That can cause some hurrying. And functional incontinence, meaning we are having difficulty getting to the restroom in time. Most important thing to consider when we're trying to decrease incontinence is staying on a scheduled track. When we are rushing to the bathroom, that's when a lot of the times falls occur, either rushing to or trying to transition on or off the toilet. By avoiding these urge scenarios, we're going to be best implemented by creating a scheduled voiding pattern every 2 hours. And if we need to decrease or increase, we can always do that. And to gradually increase our tolerance, we can even play around with an intervention strategy, extending 15 minutes at a time to practice. But this way we don't get caught off guard in case we need to use the restroom. And then that allows us to prevent any rushing and falls. If incontinence is a consistent theme to causing falls, it might be a good idea to look into finding a local rehabilitation specialist that specializes in pelvic floor training. They can talk in more detail about scheduled voiding, other techniques to address to reduce our incontinence, whether that's behavior patterns, muscle strengthening, and or timed hydration and nutrition. In regards to nutrition and hydration, these are just important concepts to keep in mind and stay vigilant with your loved one. If we're malnourished, we haven't eaten in the day, or we're dehydrated, it's important to recognize that, especially if we're planning our day with activity or exercise or therapy, making sure that we're timing our hydration and nutrition so we do have energy reserves to expend when we're doing those activities will be really important to counter any sort of dizziness or fatigue that could contribute to falls. There are also ways to keep track to make sure that we're on top of everything. Often people like to carry around a water bottle that helps them track how much water they're consuming in a day to give them reminders to keep up and drink more, or let them know that they're staying on track. Additionally, with nutrition, food logs are important to keep if maybe eating frequently is a difficult component to whatever they're dealing with. And that way we can stay on top of everything going in to make sure that they're well nourished and able to tolerate even the slightest activity like walking to prevent falls. Finally, understanding what we are putting into our body. Most important thing to consider when we're dealing with any type of cancer and related falls is our medications. Polypharmacy is a really, really common aspect and intervention for any type of cancer treatment. And with that comes side effects. And so understanding the side effects of our medications, making sure that you are in good communication with your doctor to understand these side effects, and then understanding how they affect you when you take them. If there is something that may be helping you sleep that you take in the evening, but it makes you a little drowsy or dizzy, that'll be really important to understand, knowing maybe we shouldn't increase our activity, or maybe we should be extra aware to utilize an assistive device that we don't use during the day when we're ambulating those final hours of night. So understanding how medications affect us will give you a better understanding of when or when not to perform higher level activity in your day. With the many medications that we are taking, affected hydration and nutrition, all of these can play an impact on how our body is responding, and typically that is seen through our vitals: blood pressure, heart rate, respiratory rate, and oxygen. And these are simple things that we can track at home with a machine that are often easily acquired over the counter. Knowing our medications, how they impact these vital signs, and then correlating them to the actual vital sign check on a frequent basis throughout the day can give us that much more information to understand, oh, my blood pressure is low. I feel dizzy. Maybe I need to eat something. Or I understand that a certain medication may drop my blood pressure, and that has an impact on my balance. So getting a good feel for your vital signs and how they correlate to how you feel in regards to dizziness and balance is an important aspect to further enhance your ability to reduce risk for falls. Another common side effect that we have with the medications that we're taking in regards to cancer treatment is neuropathies, and this can cause numbness and tingling in the bottom of the feet. This often can cause a decrease in our sensation that has an impact on our balance. Knowing this is going to be even more important when we're trying to ambulate in areas where we are more reliant on feeling the ground underneath us. And this is a little bit going back to the environment and lighting. If it's darker and we need to feel because we cannot see, it'll be extra important to understand that maybe we don't have as much sensation in our feet due to the medications we're taking, and to be even more vigilant when we're using our walker in that situation. So a lot of the time, people that don't need a walker during the day may need to have one by their bedside when they're using the restroom in the middle of the night, because their feet and their sensation might not be up to function as they would hope to help them maintain their balance in a darker environment. So additionally, with neuropathies and taking that into consideration, it's very important that when we are trying to prevent falls, we have some type of grip underneath the bottom of our feet. Walking barefoot is typically not recommended. We want to make sure we're using, at the very least, hospital socks that have a gripped bottom, preferably a secure slipper and or shoe around the house to ensure that if there is a wet spot or if there is linoleum floor versus carpet, that's not going to cause slip, which could then in turn cause a fall.